Welcome to the Gladden Longevity Podcast with Dr. Jeffrey Gladden, where our passion is helping you become an age hacker. On this show, we want to help you optimize your life energy, longevity, health, and human performance with impactful and actionable information by answering 4 questions. How good can we be? How do we make 100 the new 30? How do we live well beyond 120? And how do we live young for a lifetime? I'm Steve Ryder, and Dr. Gladden, we just wrapped up with Michael Ruscio and talking about gut health.
Yeah. Michael was a fascinating interview, quite honestly. He's really taken gut inquiry to another level. I think, if you have any interest in your gut and optimizing it, you're going to love this show. We kind of deconstruct a lot of myths, a lot of things that we used to think that we don't think anymore. Some very logical, simple approaches to approaching the gut. We really cover a lot of great territory here. So it's beautiful.
Yeah, this is one that throughout the entire interview, there were times at which you were like, yeah, that's interesting.
Well, they've been doing clinical research in their office. And then also they have a podcast around gut health and probiotics and things. So he's gone really deep down the rabbit hole on all this, which was super fun to kind of go with him on that. Yeah. Welcome everybody to the Gladden Longevity Podcast. I'm your host, Dr. Jeffrey Gladden, and I am here today with my good-looking buddy in Colorado, Steve Ryder. If you haven't seen Steve in person, you're missing something, I think. So maybe not a lot, but you're missing something. So
how was your weekend, Dr. Gladden?
It was great. Really great. Yeah, working on some really, really interesting projects here.
Really? Give the listeners just a little tease.
I can't even tease it yet. It's
really,
it's world-changing stuff. So super excited about it. Yeah, really, really cool. Anyway, I had a guy down here in Puerto Rico with me working on some stuff. And anyway, the good thing was the surf was up. So we had to body surf every day. We took some breaks. Nice. So that was the sweet part of it all. But nice. Yeah, super fun stuff. So today we're going to dive into an incredibly important aspect of health, incredibly important aspect of performance, quite honestly, and longevity, if you will. So we're really happy to have Michael Ruscio with us today, and he's from Austin, Texas. And Michael, welcome to the show.
Hey, thanks for having me.
Yeah, good. So, Michael, tell us a little bit about your journey, how you found your way into the colon or the entire.
Yeah, not a spot many people find their way to.
Not many people are aspiring to end up there.
Yeah. I mean, going back into college, I knew I wanted to help people. I enjoyed academics and studying, and I was a little bit of a burly guy. And when I decided to go into medicine, my advisor said, "Well, you're kind of muscular. You should be an ortho right. surgeon." Yeah. And being what was I, 20, 21? Sure. Okay, sounds good to me. I know nothing. I think medicine is essentially Grey's Anatomy at that point in my life. And as I'm trucking along pre-med, also playing sports, lacrosse in college at that point in time, I went, as I think most 20, 21-year-olds do, from, feeling invincible to having insomnia, brain fog, fatigue, depression fairly acutely.
Okay.
And it was certainly dissettling, but I'm thinking, okay, this is what doctors do. I'll go see a few doctors. And I saw 3 conventional doctors, all really nice people who wanted to try and offer whatever they could, but no one could find anything essentially wrong with me. So eventually I found my way into alternative medicine. I think like a lot of people end up doing, right? Which you go the conventional route. And I think it's just quick to make an aside here. You, in a way, can take solace. If your medical doctor said there's nothing wrong with you, that means in a way there's nothing hugely wrong with you. There's no overt diseases. And that's where I think the conventional doctors did a good job, is they made sure there was no overt diseases. I wasn't hyperthyroid. I wasn't hypothyroid. I didn't have some autoimmune disease.
Well, we could even argue about that, quite honestly, whether or not they do a good job of even defining the disease that they think.
Sure, that's fair.
Yeah, but to your point, they have a toolkit and they have a thought process, and they're, they can be very diligent about going through that, right? Very good-hearted and diligent about doing it, right? I think that's what you're saying.
And agreed, it's not all-encompassing. Yeah, it's certainly not all-encompassing, which is why I think it's good for people to have a team, people on sort of the conventional side and the alternative side, so you can get a broader purview of the potential issues that could be at play. And that was what happened with me. I had an amoeba histolytica.
Okay.
And diverted my thinking to, well, I really want to go into alternative medicine now because of my personal experience.
Mm-hmm.
And there was a lot of good in alternative medicine, but there was also a lot that really bugged me. And I don't think this is devoid in any field, but just a really dogmatic,
Mm.
everyone's got to be off gluten. And, if you ground in earth, you'll never see this is really like extreme positions.
That's right.
And so,
I call this binary thinking.
exactly. So I found my way questioning a lot of the norms in sort of alternative or functional medicine. And this
Mm.
is why now I'm in clinical practice, trained as a DC and a DNM, but also doing a decent amount of research. We published 2 papers last year. We currently have 1 paper under peer review. We have another paper in the works, actually, hopefully what will be a review on probiotics, and really trying to bring people a responsible perspective on gut
Mm.
health,
I love that.
open-minded on the one hand, but also not drinking the Kool-Aid of the field on the other and saying, well, some of these things, they sound
That's
good, but they're
right.
kind of specious, and let's do some fact checking. And that's
That's right.
sort of where I find myself today.
Yeah, no, I think that's really wise on your part. When I got into the field, there were so many people in different camps about, it's all about this, it's all about that, it's all about this.
Right.
And what you come to understand fairly quickly is it's never all about any one thing. It's really a very complex ecosystem, right, that has to be balanced. And so that was kind of a big insight for me early on as well. I'm curious though, how did you get the Entamoeba histolytica? How did that come about? You're playing sports and you went to I don't know what happened.
Never left the country. Didn't have your stereotypical traveled food poisoning, somewhat self-resolved, and then lingering symptoms post. And I should also say, to your point about it's all this or it's all the other thing,
Mm-hmm.
parasites is something that you'll see people say, well, if you're not feeling well, it's a parasite. And we know that the tests were abnormal, or, the test didn't show any parasites, but you probably do have them because the testing is too limited. And I can say, as someone who ran 2 stool tests, and these are purportedly the best stool tests in functional medicine on every patient. I've probably looked at over 2,000 stool tests.
Yeah.
Finding true parasites is exquisitely rare.
Yeah.
As someone who actually had one.
Yeah.
I think more often,
but not commonly, to your point, just for the audience. Like, we do find them, but it's not like super common. So, yeah.
Yeah, it's quite rare. But what is more common is something that's much less sexy. It's not death from the outside invaders. It's your own flora is disrupted, or there's some immune dysregulation. So it's not this, it's this one thing, but to your point, it could be the ecosystem being disrupted by a number of different factors. And if we can just sort of shift the health milieu back to a positive place, then a lot of the symptoms someone's worried about will go away.
Yeah, exactly. So we've come across people that overtly have gut issues. And then in our world, we're testing across a whole spectrum of things, right? A lot of longevity metrics, a lot of health performance metrics, et cetera. And I'm sure you're doing similar things in some extent. But the interesting thing for us is that we routinely check people's guts, whether they're complaining of anything or not, because it's so common to find issues that are then compounding another issue someplace else in the body. So you want to speak to that a little bit about how you guys think about that? I mean, is the only person that looks at gut being somebody that comes in with bloating or, constipation or diarrhea or whatever, or do you think about it? Because I think it's kind of more foundational at this point.
I think that the gut work is pretty foundational. We use a model that we call diet, lifestyle, and gut health foundations, meaning that's where I think we should start, because if you hit those, you're going to take care of so many things downstream to that. As it pertains to testing, really over the past year, we've been doing much less testing, and there's a few reasons why. The sort of meta conclusion is a lot of the tests either don't discriminate very successfully between healthy controls and symptomatic cohorts, or they're just not super accurate, and they're based upon early sort of speculation. Stool zonulin is one good example. Again, as someone who's doing stool zonulin for over 5 years, a recent meta-analysis in Frontiers in Immunology from 2023, they didn't find that stool zonulin correlated with improved health of the host, reduced symptoms, reduced LPS, reduced cytokines, but serum zonulin did. And that was a really pivotal finding for me. Again, as someone who was running stool zonulin for so many years, and then finding, this meta-analysis of several clinical trials that gives us a purview of what the body of literature is saying at large, isn't finding a correlation between stool zonulin and the person in front of you. One other example, SIBO breath testing, 2022 meta-analysis,
Yeah.
found that in those who had the symptoms of IBS, SIBO breath test positivity rate was 36%, and in healthy controls, it was 28%.
Yeah. We've not been impressed with breath testing, quite honestly. It just seems
Yeah,
too skittish, right?
yeah.
For sure.
And I think the challenge is that the patients aren't feeling well and they want the doctor to do something, and it puts this
Mhm.
pressure upon the doctor. And it's almost as if the doctor will feel they're doing the patient a disservice if they don't do the test. And I think it's important for patients to understand that if you trust your clinician, if they're trying to talk you out of a test, it might be because they're aware of recent research that's showing these tests may not be as accurate or as helpful as we previously thought.
Yeah. I think there's a lot of wisdom in that. One of the things we come across is that, and we learned this years ago, as you probably did too, is that there really is no normal gut biome. There really is no normal gut biome, right? So
Right.
if you are doing a test and you're looking for an abnormal gut biome, you can be looking for pathogens and you can be looking for the presence of helpful bacteria and things like that. But there really isn't a standard gut biome. And so, that kind of complicates it too. We do pick up other things that are interesting, like whether or not somebody's actually digesting their fats appropriately or their protein appropriately, or, there are other things that come out of a stool test that we find helpful as well. But yeah, I think it is always good to look at your tests and understand that it's always a fuzzy view of what it is you're trying to look at, right? So,
Right.
yeah.
And this is where my view has progressively become use the person's history, their symptoms, and also their response to various changes or therapies that they've done. Simple things like,
Yeah.
man, I tried going really low carb for a week and I noticed my digestive symptoms got a lot better. And then I tried going really high fiber and things flared. Well, okay, like that's a really important signal. And
Yeah.
I wouldn't care what someone's, let's say their stool test found low levels of commensal bacteria. That might conclude or lead a clinician to say, well, then up your fiber. But we know that's going to flare a lot of people. And we can get into the complicated backstory on that because the stool tests are assessing 5 feet of the GI and they're missing the 22 feet of the small intestine. So even though we're doing a test, we're really getting a minimalistic slice of what's going on in the gut via that test.
That's right. That's all really good input. So that being said, when somebody comes to you and they're asymptomatic, do you do anything for their gut or do you just leave it alone?
I think a probiotic is a really justifiable intervention. Although I don't feel we can confidently say that people who are asymptomatic need to be on probiotics, but there have been a few studies, one in nurses actually, that found nurses under stress could be kinder and more empathetic when they used probiotics. They had better mood scores, even though they didn't have baseline low mood. They did find a significant improvement in mood with a probiotic supplement. And a different study found otherwise healthy controls had improved antioxidant status when they used a probiotic. So there may be some benefit for otherwise healthy people taking a probiotic.
Do you think that had any impact on their serotonin levels? Since we know the gut's a source of serotonin and bacteria in the
Probably.
gut. Take that? Yeah.
Probably that and the limbic system. There was a really, I think the lead author was Quigley, who did a trial where they found that limbic system, specifically amygdala activity, reduced when they gave a probiotic in a anxious cohort that also had IBS. They found anxiety levels came down that correlated via functional MRI scans of the brain, showing a reduction of the amygdala. And the amygdala, just for your audience, this is sort of your danger sensing apparatus in the brain, which when we were hunter-gatherers, we really needed that. Let's say if you were walking along with your buddy, he grabs some berries, eats those berries, then throws up for 3 hours and you watch him die. You want to make sure those berries are seared into your memory. That's what the amygdala does. But nowadays, there's just so much social media. Someone said something snarky to you. It can be so overactivated that it correlates with anxiety and depression. Yeah. So interventions that can reduce amygdala activity can be quite helpful. So it might be twofold: amygdala, limbic, and production of serotonin.
Yeah, interesting stuff. So are there probiotics that you're particularly fond of? We tend to pick them based on what we found and what somebody's dealing with. Like maybe we're trying to bring down their hemoglobin A1C, or maybe we're trying to boost their mood, or maybe we're trying to rehabilitate some element of the gut or whatever. Would you mind sharing your thought process about how you think about what probiotic to give to an individual?
Yeah, no, I'd love to. This is something that we've given a really extensive amount of thought to, and we're,
Mhm.
when I say we, it's me and our research team. Pretty much every clinical trial that's being published on probiotics, we're reading. We do a monthly podcast just summarizing the latest probiotic research. And
Mhm.
over the past several years, we've been developing what we call a meta protocol, meaning an all-purpose protocol. If you look at the research on IBS, IBD, inflammatory
Let's define
conditions.
those. Let's define those acronyms for the
Yeah,
audience.
thank you. Thank you. So if you look at the research on irritable bowel,
Mhm.
gas, bloating, distension, pain, constipation, diarrhea, inflammatory bowel disease, ulcerative colitis, and Crohn's, atopic conditions like dermatitis, breakouts, urticaria, lesions, anxiety and depression, there's a large body of research being published on probiotics. And what we've been doing is looking for commonalities across all these trials in terms of the formulas that have been used and the dosages that have been used.
Mhm.
And over time, you see a few really important concepts sort of emerge. One is that the same probiotic formula will show benefit for different conditions. So the same formula
Let me
that
ask you
helps.
this. Let me ask you this. So the
Yeah,
same probiotic is either treating multiple conditions or it has different effectiveness in different conditions.
probiotics tend to have pleiotropic effects.
Okay.
So as one example, the
Right.
same formula, let's say VSL3,
Hmm.
it's a blend of lactobacillus and bifidobacterium. It's been shown to help with diarrhea, but also with constipation. So unlike some sort of antispasmodic or, some bowel laxative, it can only
Hmm.
kind of go one way.
Right.
With probiotics, they tend to be corrective, which I think is really important to understand, because if the gut is causing inflammation and all these downstream effects, then in some people that gut-derived inflammation may manifest as anxiety, other people as diarrhea. That's why I think we should look at probiotics not like drugs, but as treating this really important system upstream, the gut, that causes a lot of downstream impacts.
Hmm. So what I'm taking away from what you're saying is that as you're reading the literature, you're basically finding that there are certain probiotics that seem to have these pleiotropic or this multitude of different effects or affecting multiple different conditions. And so and correct me if I'm wrong, because it's really inherently a question. And then you're prone to choose those probiotics to treat people when you're seeing them in the clinic. Is that a fair statement or not quite?
I modify it slightly in that I used to think that you needed a certain probiotic for a certain condition,
Hmm.
but now since you see one probiotic treating multiple conditions and there's just so much overlap,
Yeah.
I think we should consider it, how do we use the most holistic probiotic protocol and
Hmm.
then see how many conditions it can resolve, rather than choosing probiotics like drugs for a specific condition.
Okay, I got your thought process. So that raises some interesting questions. Like, one of the things that we were taught is that, probiotics need to be cycled, that you shouldn't be on the same probiotic all the time. I don't know if you feel like that's true or not true, but I'm imagining if you're thinking about treating somebody with a unified theory of treatment, if you will, then there probably is a timing and a sequence potentially of when you're introducing this and that and this and that. And it's probably associated with other dietary changes that may be appropriate to the individual and some stuff like that. Do you want to talk through a little bit what that course of treatment looks like?
Yeah, it reminds me of the posit by Occam's razor, which
Yep.
is the simplest solution is usually the best.
Right.
And this has been kind of the arc of our conclusion over time. It was much more nuanced, right? You avoid Saccharomyces cerevisiae probiotic if someone has inflammatory bowel disease, because you can have Saccharomyces antibodies inflammatory bowel disease. Then a year later, giving that same probiotic shows the ability to reduce and treat inflammatory bowel disease. A lot
Hmm.
of these things are really, I think, understandable assumptions, but then the clinical trials are just kind of disproving complexity
Hmm.
and more so proving simplicity. So to your question, in 2023, there was a few trials that really changed my thinking on, do we need to cycle? Mainly because in the models of constipation or MCI, mild cognitive impairment, they were finding that people may not see full benefits from just the one formula that's being studied in this clinical trial until 3 months, or in some cases 6 months of use. So at least that tells me, and I partially infer from that, we may need to be on a probiotic for a certain amount of time, upper limit 3 to 6 months, to realize the full benefit.
Right.
And then also, there's not really anything published showing that one needs to cycle. And I think it's more that the probiotics have this transient impact. Pretty much all probiotics will stimulate the immune system in a beneficial way, triggering these toll-like receptors, most namely TLR4, this receptor that's responsible for sensing endotoxin and chiefly regulates leaky gut. We know probiotics can downregulate that receptor, and that probiotics release antimicrobial peptides that fight things like SIBO and dysbiosis. So it might be most accurate to say that probiotics have this transient impact, kind of like tourists who kind of come in, they spend some money and stimulate the economy, and then they move on. But you want more tourists coming in, continuing to recreate and spend money. So I think that the best way to look at how to build someone a probiotic protocol is use one formula and keep them on that formula until you see them plateau. And then after a few months, have them try to come off and see if they can maintain the benefits. But cycling, I just haven't seen anything concrete that would suggest that we need to cycle.
Okay, that's cool. That's very cool. So what's your go-to initial probiotic that you would use?
So the framework is there's really 3 types. You've probably heard of the soil-based probiotics. They're kind of the newer kid on the block, getting a lot of popularity. Megaspore would be one example. Biospora would be another. These are blends of bacillus species. So Bacillus licheniformis, Bacillus clausii, Bacillus coagulans. That's one type. The second type, you may have heard of Floristor or Saccharomyces boulardii is the main species in this formula. You're also seeing some research on Saccharomyces cerevisiae, but essentially it's a probiotic fungus. That's what we call the second type of probiotic. And then the third type is a blend of Lactobacillus and Bifidobacterium. This is your VSL3 type, more traditional type. And if you look across the studies, you're usually seeing the probiotic formulas used in the RCTs, the randomized control trials, be one of these 3 types. Sometimes it's a blend of the 2 different types, but as a sort of meta big picture takeaway, it's usually one of these 3 types that's being studied. And I think you can make a case for starting with any one of these. The most research is on the Lactobacillus and Bifidobacterium blends because they're the oldest. Therefore, there's been the most research published. What we've been noticing in the clinic, and this is anecdote, hasn't been published yet, if you start someone on the one and you've seen some benefit, then you can add in a second and a third probiotic. We call it triple therapy.
Okay.
Almost like using 2 antibiotics or 2 anti-inflammatories or 2 blood pressure medications, however you want to think about it. And we're finding some signal that this seems to be better than just one formula alone using the 3. And just really quick, there's some parameters for the dosing of these. Lacto-Bif, you're looking at anywhere from 1 to 50 billion CFU per day. The Saccharomyces, between 10 to 15 billion CFU per day. And the Bacillus species or the soil-based, between 2 and 6 billion CFU per day. You'll usually see response within a month, but you may want to wait 2 to 3 months as a minimum time point to assess initial efficacy.
Got it.
This episode of the Gladden Longevity Podcast is brought to you by the new Gladden Longevity Blood Vessel Formula. The Mediterranean diet is often associated with heart health and longevity, and while red wine is often highlighted, it's actually the herbs traditionally used in this diet where the real magic is.
And Mediterranean herbs such as summer savory, basil, rosemary, and tarragon contain potent antioxidants that have been found to inhibit something called RNOx activity. And RNOx is a major promoter of oxidative stress in the arterial wall, which causes the arteries to age, increases blood pressure, decreases sexual function, etc.
I love that this formula has summer savory because I've never seen it in the fresh herbs section at any of my local grocery stores, even the health ones like Natural Grocers. And to get these benefits in a tincture, brilliant, Dr. Gladden.
Well, I'll tell you, I've heard from our clients and from my own use of it that they love it as well. You know, I just take a few drops or a dropper full and put it in my tea. It is alcohol-based. Tincture is the nutrients are extracted with ethyl alcohol. I drop it in my tea, it tastes good, or I drop it in water, it tastes good. And it's so nice to know that you're getting those health benefits to keep your arteries young. We love it.
Get 10% off your order of the new Gladden Longevity Blood Vessel Formula when you use the code podcast10 at gladdenlongevitysshop.com. That's podcast10 at checkout when you visit gladdenlongevitysshop.com.
If you want to live young for a lifetime, keeping your blood vessels healthy is key. So check out the new Gladden Longevity Blood Vessel Formula to assist you in your quest to make 100 the new 30. You know, it makes sense that you could see benefit from adding some things together. We see that all the time, that there are synergistic effects of lots of different things, right?
Right.
So it would make sense to me that you might see that. Have you looked at any of the probiotics with regards to their impact on any of the hallmarks of aging?
Good question. To the extent that we're talking about antioxidants, yes. And there's been a few trials that have found, like I mentioned earlier, using a probiotics can improve. I believe the one marker that's been looked at has been glutathione. Sirtuins or other factors. I can't say I've looked too deeply into those sorts of markers.
Okay. We did some interesting testing looking at it was really kind of a retrospective look at some of our clients that were taking a particular probiotic to see the impact that it might have had on their DNA methylation ages. And DNA methylation age is not the holy grail of anything, quite honestly, but it is interesting. And this was back when we should probably repeat this, quite honestly, because when we did it, the tests were a little more fuzzy than they have become today. We were looking at sort of extrinsic and intrinsic DNA methylation ages and not sort of rates of aging, which are a little more durable, a little more sturdy kind of metric. But anyway, what we found was that in some of the people that were taking a particular antibiotic, their DNA methylation ages were going the wrong direction, which was hard to explain because all their other symptoms were getting better. And so, it just goes to show you it's a complex system. There's many things to kind of entertain. It would be interesting to look at what's actually happening to some of the hallmarks of aging, like DNA methylation, oxidative stress, even telomere attrition. I don't think they're going to have much of an impact on a lot of the other ones, but they could impact mitochondrial function potentially. I don't think so much maybe around autophagy or some of those kinds of things, but it would be interesting I'm just thinking out loud with you here, it would be interesting to see, right? Because sometimes there can be a therapy that's good for the system and the symptoms, but it actually, it's a shorter term game for a longer term loss, so to speak. So it's funny because I tend to think of things a little bit in the inverse, in that it's so, I've seen in a fair amount of cases a biomarker. Let's go back to the stool zonulin, right? Yeah.
Treating the stool zonulin, and then after 5 years of research, we see that there's a poor correlation between stool zonulin and other markers like LPS and cytokines. Mm-hmm. But riffing off of what you said, what about something like looking at grip strength or VO2 max that we know probably have really good correlations to all-cause mortality? I think that, or maybe you look at this whole assay, right? You look at some of the DNA methylation, but you're also doing a grip strength test. And if you can get people to do it, a VO2 max test, and kind of looking at this bigger mosaic of data points. It's a bigger ask. I get that in terms of how you do the research, but that would be cool to look at. We should coordinate on that because we do those things routinely on all our clients. Very meticulous about doing cardiopulmonary exercise tests on everybody. We do full on, physical grip strength, planks, all kinds of metrics. Oh, that's awesome. Of speed, agility, quickness. And we're really big on VO2 max testing because it is such a strong correlate for longevity. But we have such a fine lens at arterial function through that, right? With the test that we're using, this MET test that we're using, we can really see really, really early if there's any signs of left ventricular dysfunction with exercise. And so that becomes super helpful for us in terms of helping to know where to go with an individual or if they're making progress, for example. So it would be interesting. We should talk offline and maybe we could even put together, we have a research department also. Got a couple. I'd love to. Process. Yeah. And so we could send you some of our triple therapy and just standardize that, because we're trying to publish, and we have in the works before that we have we're looking to do a wait list RCT on this meal replacement formula that we're using in a sort of off-label application and show that the off-label application actually works. But then after that, we want to do more with a triple therapy, because I really try to be careful not to just speculate And, you become that person who had an idea year 5 of their career, and then you're 40 in still making that same speculation. It's like, hey, at what point are you going to actually test your hypothesis here?
That's right. No, that's right. Yeah. And we're meticulous about that as well, right? We always try to innovate. We're not married to the answers. We're only married to the questions. How do we do it better?
I love that. That's great.
Yeah. So anyway, that would be fun. Yeah, we could put that together, and that'd be super, super interesting, because I think this is such an important topic, and I agree. It came on everybody's radar. Okay, this is critical. There's more bacterial DNA than human DNA. I mean, this is who's living with who here, right? And so all this kind of stuff coming out, and yet really trying to figure out how to optimize it can be kind of challenging. So I'll tell you what we've started to do with gut health, and you can criticize this, I'm sure, but our approach really is, when we find pathogens, is to try to knock out the pathogens and then come back in with the probiotics. And in many cases, we'll use a prebiotic if they tolerate it. And then we've also started using postbiotics. We find it can be actually very helpful. We've been impressed with postbiotics. And then the other thing we're using oral peptides as well, like oral BPC 157 and KPV. And so that combination, when we do that, it seems like we're able to heal virtually anybody's gut, over some period of time, some months. But that's just worked out really well for us. So
yeah, well, let's riff on that, because I used to do the antimicrobial therapy first, but there's just been so much data demonstrating that probiotics are actually fairly potent antimicrobials, that we now use the probiotics first, and then we'll recheck either their labs or their symptoms or both. And then if we need to, on top of that, we'll administer an antimicrobial of some sort. And there's actually pretty good data supporting this to some extent. If you look at meta-analyses on probiotics for treating SIBO, you see about a 50% clearance rate. Same thing for rifaximin. Meta-analyses on rifaximin, about a 50% clearance rate for SIBO. If you combine probiotics with rifaximin, you get an 85% clearance rate. So then it becomes a question of, well, and this is, I guess, more so philosophical, but do you start with antimicrobial therapy first or probiotics? And I think you get a more well-rounded milieu shift with the probiotics.
Yeah.
And it does seem that if we have these positive inputs, if someone's sleeping well, exercising, probiotics, healthy diet, all of this is encouraging balance in the ecosystem. And then you may not need the antimicrobial, but if you use it, all those inputs are going to help you maintain balance longer term, and not see what happens in some cases is post-antimicrobial, they're good for like 3 months and then they regress and have a return of their symptoms.
Yeah, I may have misrepresented what I meant to say, which is that we're doing these things simultaneously. It's not measured out sequentially. We're starting with all of these. It's just the order of my thought process. So we're doing it that way. But I think there are some good points that you're making there. So one of the things that I've seen with SIBO and the gut, I'd be curious to get your take on this, is that it's really, really difficult to get rid of yeast or get rid of bacteria or whatever if somebody continues to consume alcohol. We just seem to, those people seem to really struggle. Like if they come back and, I'm drinking 2 glasses of wine a night, it's like guaranteed we can't fix their gut nearly as well as if they'll sort of stay away from alcohol, and it could be gluten or whatever we determine other things may be. But it seems like alcohol really has a negative impact on the gut. Have you seen that as well? Or what is your take on it? Maybe you feel like it's God's gift to the gut. I don't know.
I don't know that we're looking at that in enough detail to really be able to look for correlations. And also the level of alcohol consumption, I think, is important. 2 glasses every night, that's enough to where I might say to someone like, okay, we can do 2 glasses 1 or 2 nights per week because I want to leave that crack in the door to go out with your wife or whatever it is. Because these things are really important. We see people who, as I'm sure you do too, who are so health conscious that they put themselves in kind of a prison.
That's right. Yeah.
And that can make them feel worse because all they're doing is sitting home and thinking about their health.
Yeah. No, this is the way I think about it is you can look at health as a space to contract into, or you can look at health as basically a space to expand out of, right? Expand.
I love
into
that perspective.
Life, right? Yeah.
Yeah. That's great.
And I think people get that wrong, right? They start to see it as a prison when actually it's a launch pad, right?
Yep.
So,
and then coming to Candida, and we recently did a review on this, and there was a few interesting things that we found. If you look at, there was a paper by Bernetti and their cutoffs. I may have some of these magnitudes slightly off, but I think they were using a cutoff of 100,000 or I think it was 10,000 units per gram of stool to constitute positive candida.
Okay.
And then a different well-regarded paper was using 100,000, and then some functional labs are using 5,000. So in terms of what we tag as a positive, doesn't really have good agreement across research studies, and the functional medicine test might be using ranges that could be too scrupulous, if you will. And why this matters is due to another study that I found to be fascinating. It was just one person, but they had the individual change their teeth or toothbrushing pattern from brushing them once per day for 2 days, and then after every meal for 2 days. And they went back and forth for something like 2 weeks.
What kind of toothpaste?
I don't know the kind of toothpaste. It's probably in the methods.
It's actually it does matter, quite honestly. So, but anyway, okay.
Well, what was interesting is they found a 10 to a 100-fold change in levels of stool candida based upon how they brush their teeth.
Interesting.
So if the tests are that skewed,
who had more candida, the brushers or the non-brushers?
The people who brushed more frequently had less candida.
Okay.
Which was surprising to me, given the fact that you're doing a stool assessment. I wouldn't think that you would get candida all the way down, unchanged into a stool sample through the colon. But nevertheless, that gave me a little bit of pause. We also were testing for a while candida antibodies. Sometimes they're called CIC, candida immune complexes, and looking for correlations between hallmark symptoms like thrush or carbohydrate intolerance. This is unofficial. We didn't go back and analyze the data, but just sort of clinically looking back and ruminating, I couldn't see any correlation between those candida-like symptoms and the antibodies positive. So I'm a little bit tenuous in terms of how much we can take away from a stool or an antibody test for candida. I mean, maybe, but as I've looked at it, I've had more questions and answers as I've looked into it.
It's back to some of what we talked about earlier on in the podcast, which is that, you're asking a question of a test and you've got to be skeptical of the fuzzy answer that you're getting back, right? So I think it boils down to, I mean, in our heart of hearts, what I think is that if we had more precision, right, if we understood things at a more comprehensive level, that if we did that well enough to really do justice to the complexity of the ecosystem, right? So you're not just all about one thing. Well, we just have to push this down because we know that's never the answer. We have to raise this up, right? But if you really had that deep understanding across the balancing of the ecosystem, that you could make more informed decisions, right? And so we're left.
That's the hope.
That's the hope, right? When we're left making decisions with partial information is what it boils down to, and then seeing how it works out. I mean, that's still the reality of medicine today. Yeah.
But I think you make a good point, and one that if I draw that line of inference a touch further, sometimes what I feel clinicians do is they withhold treatments until they have a biomarker positive.
Good point.
And I can say in the realm of gut, that is clearly the wrong way to do it. Yeah. And we just released a video on this. More people respond to SIBO treatments than test positive for SIBO. Clearly. And I'm talking about randomized controlled trial data. Yep. So it's not me cherry picking some mouse model study looking at mechanism. So if you say, well, I can't use antimicrobial therapy because you don't have SIBO, that's literally hurting people because they would otherwise. And look at rifaximin. Rifaximin is FDA approved for the symptoms of IBS, not requiring the biomarker of a SIBO lab being positive. So I think it's good for us all to sort of, take your point and keep that in mind.
Yep. No, I think that's a great point. You see that all the time in traditional medicine also, right? Where your ANA is not positive, therefore you possibly couldn't have an autoimmune disease, right? You see that kind of logic, right? And so it's, I think it boils down to listening to the patient. It's really kind of what you're saying. So
I agree. It's a lost art.
It is, yeah, but it's really the key piece. Yeah, that's very, very cool. So when you're doing your, we'll call it triple therapy, is there a sequence in which you're adding those? Are you starting with the VSL3?
Great question. There only is in someone who's exhibited signs that they're very sensitive and reactive. And so in those people, we send them home with the 3 separate bottles rather than an all-in-one formula.
Nice.
And we'll say, start these one at a time. Now, if they've said, well, I tried Fluorostor in the past and I think I had a negative reaction, we'll say, depending on the clarity, because sometimes it's it may have aggravated me. Or other times it's I had diarrhea for 5 days. I stopped the probiotic for a month. I tried it again. I had diarrhea for another 5 days. So if it's really clear like that, we'll say, okay, no Saccharomyces boulardii for you. We're going to put that to the side. If the signal is unclear, in whatever order the person wants, we'll say just start one at a time. Give yourself maybe a week interval before layering on the second one. And anything that's tolerated we'll keep, and anything that's not tolerated we'll put to the side. And we do see that people who may respond with a negative reaction month 1, once you're month 2 or 3, they may tolerate the other probiotic, just like other foods, wherein food tolerance also improves over time as the gut heals.
That's really interesting. Let's talk a little bit about food for a second, because we mentioned that early on, a little bit about understanding food, its impact on the gut, impact on gut health. There's.
Can I slip in one point here? I want to make sure not to forget this. It's a connection I've recently made that I think is potentially empowering and freeing for people. And the summary here is that I have the feeling that people who've taken gluten out of their diet and felt better, that is more likely to be due to the fact that they're reducing FODMAPs in the diet, or these fermentable carbohydrates that can flare the gut, than it is that they're non-celiac gluten sensitive. And this comes from a couple observations. A paper by Volta, who's at the University of Bologna, he assessed 12,000 people pretty comprehensively, and they found about a 3% prevalence of non-celiac gluten sensitivity. But within that cohort, it was about 40% who had IBS, irritable bowel. And we know that people with IBS tend to be FODMAP sensitive, and that gluten is high FODMAP, but also that over half of the FODMAP foods that are reintroduced can later be brought back into the diet with good tolerance. So what this could mean is that gluten intolerance is FODMAP sensitivity, which is temporary, rather than being purely immunogenic. And I'm not saying there's no non-celiac, but what I'm saying is I think a lot of people see initial improvement when they take gluten out, and then they assume, gluten-free in perpetuity because of my initial improvement going gluten-free. And it might not be the case for some people.
Interesting. Yeah, I guess the only way to try that would be empirically to put it back in and see what happens.
And if nothing else, people just, coming back to going out with your spouse for maybe a glass of wine, and maybe you can have some bread. And I'm not making the argument that it's a staple, but if nothing else, giving people some food freedom to periodically have some gluten.
Well, I think, when we think about diet from a metabolic perspective, not necessarily purely from a gut perspective, but really the goal for us is metabolic flexibility. It's not about being all keto, all carnivore, all vegan. It's not about that. It's really about a wide variety of nutrient-dense foods and
absolutely
developing that metabolic flexibility to be able to eat a piece of bread or, have a steak if that's what you did. So, yeah.
Agreed.
Yeah. So when it comes back to food and the gut, what are you doing from the standpoint of analyzing somebody's diet? Are you doing food sensitivities? Are you doing just empirical dietary changes, or how are you going about that?
Yeah, mostly empirical. It turns out, at least for IgG, that IgG antibodies to food is actually part of the normal tolerance response. And that sort of test doesn't really discriminate between reactive cohorts and those who are not. Again, something, if you asked me 5+ years ago, I would have said, do XYZ food allergy tests, until we really dug into some of the data underlying those tests.
Yeah.
And then also, someone might be sensitive to the FODMAPs or to the fiber or to the histamine, and that's not going to be picked up on a food allergy test. So I think it's much more scientific, actually, to do it empirically based upon a withdrawal and then a reintroduction. And to your question, we'll look at their history. We have a table in our paperwork. This is how sophisticated a lot of people we work with are. But, have you tried paleo, low FODMAP, low carb, carnivore, vegetarian, low histamine? And a lot of times, just by looking at sort of the diet table along with their comments, and it'll ask them, tried it, didn't try it, had a reaction, comments, you might see, tried keto, didn't sleep well. Currently, I'm on paleo low carb and I sleep okay, but not that well. I'm a female and I have thinning hair. It's like, well, okay, it's pretty obvious at this point. You've been indoctrinated to thinking all carbs are bad and you need more carbs than you have. Or it might be that someone's doing paleo with lots of fruits and vegetables, kind of like a Terry Wall sort of approach, which can be great. But if someone has sensitive digestion, all that fiber, all those FODMAPs, at least temporarily, may need to be reduced so that they can rebalance and then have better dietary tolerance. So you do learn a lot, again, listening to sort of their story and their history to steer what the recommendation going forward might be.
Yeah, that's right. I think, we were looking at the IgG, IgA, IgG, IgG4, all these different things, trying to figure it out, trying to be precise, right? And then we kind of started to move away from that into some more functional testing to look at food sensitivity. And I always look at these things with a bit of skepticism, but it's, sometimes you find something that's like a diamond in the haystack or a needle in the haystack. It's like, oh, okay, good. Well, let's take this out. And then all of a sudden they have an impact. So, we do try to do the best we can. So yeah, it's interesting. Cool. Well, it's been really kind of a fascinating conversation. Is there some other points that you'd like to make for us?
One I'd want to make is, and I think you probably do a great job based upon our conversation of not giving people a fearful perspective about food, but we just see so many people who they come in and social media and the internet just seems to reward, as you mentioned earlier, extreme positions.
That's right.
And so they read about how vegetables are trying to kill you. The, Western countries have diabetes and metabolic syndrome and it's carbohydrates' fault. And, they come in afraid of everything.
Yep.
And that's really not true for the most part. I'll give one quick data-driven example that reinforces this. If you look at blueberries, all right, blueberries part of the dirty dozen, as I'm sure you know, the most pesticide-laden foods. Yep. So I had some groceries delivered to my house recently. They were supposed to be organic blueberries, but the carton was conventional. And they sat in the fridge for a couple of days. And I'm going back and forth in my mind, like, oh, blueberries, they're good for you, but all the pesticides, should I not eat them? I came across a meta-analysis that found that blueberry consumption improves cognition and reduces mild cognitive impairment in inclined or impaired cohorts. Mm-hmm. And they're not isolating for organic blueberries only. So even if they're conventional blueberries, you still have a brain protective effect from blueberry consumption. So I said, okay, Mike, chill out a little bit. You can have this carton of conventional blueberries. You're going to aim for organic most of the time, but you don't need to be so tight about the choices that you make.
Well, yeah, you don't have to be so anal about what goes in your mouth, right? That's one way to state it. So, the other thing that happens in this space that I think is really sad is that people become so binary in their thinking that you've heard this term, probably the food Nazis, right? Where it's like you're sitting at somebody, you're going to eat that? Oh my God, did you know that's going to kill you? It's like, it's almost like it's totally out of control, right?
Agreed.
So it's really interesting. I think if you're listening to this, realize that you're really going for metabolic flexibility, realize that gut health is really important, but that the goal is to actually be able to eat a variety of nutrient-dense foods. You don't want to be backed. Biology doesn't like to be backed into a corner, right? It doesn't want to be keto all the time. It doesn't want to be, getting all that methionine from carnivore all the time. So, yeah, exactly.
And that a healthy gut can process a wide array of omnivorous foods, just like a healthy musculoskeletal system can run, can jump, can squat, can deadlift, can bend, can twist. But if you have a back injury, then you're going to flare it all the time. Same thing, a healthy gut can process a lot of different foods. And if it's not healthy, then there are a lot of things you can do to improve its health and therefore its resilience.
Yeah. And to your analogy, rehab it and re-strengthen it to where it can go back to twisting and turning. Yeah, exactly.
Exactly.
Thank you for listening to this week's episode of the Gladden Longevity Podcast. If you would like more information on what we've discussed or other topics, please reference the show notes or go to gladdenlongevitypodcast.com. You can also find us on Instagram, Facebook, and Twitter by searching Gladden Longevity. If you've enjoyed this podcast, please subscribe to get future episodes delivered to you and share our podcast or this episode with someone in your life that you may find benefit. Thank you for listening. We'll be back next week with another exciting episode. The Gladden Longevity Podcast is provided for informational purposes only. It does not constitute medical advice. This content is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of a physician or other qualified health provider with any questions you may have regarding a medical condition. The use of any information and materials linked to this podcast is at the listener's own risk.